Well, as the COVID-19 vaccine slowly starts making its way across our country, we're asking infectious diseases specialist Dr. Isaac Bogoch some important questions. Good morning to you, doctor. Thank you for being here today.
Good morning. Good to be here.
Uh, I think it's important that when people are asked to put something in their body, they make an informed decision. So today we are going to inform their decision. And that leads us to our first question. Is this safe for pregnant women to get this vaccine?
That's a great question because, unfortunately, during the clinical trials, pregnant women and women who are breastfeeding were not included. So it's just that's a problem that extends well beyond COVID-19 trials. Unfortunately, there's not a lot of data for pregnant women. Having said that, we know that this infection can disproportionately impact pregnant women, and we know that the risk of this vaccine would be very, very low in a pregnant woman or in a woman who is breastfeeding. So rather than saying, no, 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 you can't have this vaccine, what's happening is the vaccine, women will be able to make choices over their own bodies and determine if they want to have the vaccine or not, but they can make an informed decision based on what we know and what we don't know. Those are answerable questions as well. And there are studies underway that are enrolling pregnant women and women who are breastfeeding who are choosing to take this vaccine so that we can have a much better understanding about the properties in those individuals.
All right, doctor, let's move to question number 2. How long does it take for someone to become immune to the virus after getting vaccinated? Which I think a lot of people are hoping they can get their shot and then go to the airport and go on vacation.
Oh, I wish that was the case. But it's first of all, it's going to take a while, and it's going to take many, many Canadians to get the vaccine before we start to lift these public health restrictions. But people will get some degree of immunity about 12 days after the first dose of the vaccine. We have to remember that these are 2-dose vaccines. Based on everything we know today, you still need those 2 doses. One of them is at day 1 and day 21. The other vaccine that we have is a dose at day 1 and day 28. You'll get maximum protection 7 days after the second dose. However, you still have some decent protection about 12 days after the first dose.
All right, yeah. So it does take time to build up. Now let's talk about the flu vaccine, because that's a seasonal vaccine, and a lot of people are wondering, will that be the case with the COVID-19 vaccine? Will we have to keep getting this season after season, year after year?
It's not entirely clear just yet how long immunity will last after the COVID-19 vaccine. And in addition to that, of course, like all viruses, this virus changes with time. And it's not entirely clear how much protection will last from this form of the vaccine, and if we'll need to revamp the vaccine in down the line because the virus has changed. What's clear is that we know, based on all the evidence to date, that the vaccine does provide pretty significant protection against getting this infection. In addition to that, it appears to be a very, very safe vaccine. It's just not entirely clear if or when someone will need another vaccine in the future. But it's probably the case, but it's a lot of speculation. Some people say 1 year, some people say 3 years. It's not entirely clear.
All right, doctor, this one is about asymptomatic carriers of the virus. Let's say you're an asymptomatic carrier and you get the vaccine. We know it's going to stop symptoms of the virus, but would it actually stop someone from being contagious?
Okay, so if someone is actually infected at the time of vaccination, the vaccine's really going to do nothing. I mean, it's not going to do any harm, but of course, the person already is infected. You might help someone boost immunity following the resolution of their infection. We also know that asymptomatic people can still transmit the infection. They might be less likely to transmit the infection, but they can still transmit the infection. And the third important point is that people who are vaccinated, even in the big clinical trials, we know that although the vaccine significantly reduced the chance of people getting infected, it doesn't take it away 100%. So you can still be vaccinated and still get this infection. What it looks like is happening is those who are vaccinated who are unlucky enough to get the infection tend to have much more mild symptoms. But at the end of the day, we are really going to need to wait for a significant number of Canadians to be vaccinated before we can start lifting things like wearing masks and social distancing, because we'll need enough people to be protected, because the vaccines, of course, like anything else in life, they're not 100% perfect. They're really, really good, but of course, they're not 100% perfect.
Doctor, with every passing day, we get more questions, and we are always appreciative that you're here to provide the answers. Thank you so much.
My pleasure. Have a great day.
Thanks for watching. If you like this, be sure to subscribe here. And you can check out more Your Morning videos right here.